we shall have the prayer song.
One of the prayer, please chant one. Come.
Good morning everyone. Now we'll be starting with our first session. For this, I would like to welcome Dr. Shakuntala Patil ma'am to come on to the dais. I now request Dr. Sarveshwar sir, our beloved principal, and Dr. Nivati Patil ma'am to welcome ma'am with a flower bouquet.
We are starting this motivated knowledge session on cancer care for integration approach. So we have our innovation at 11 o'clock because the chief guest has given the concept for 11 o'clock. We thought we should not miss our time. There are two sessions before the 11 o'clock. So I expect entire day your cooperation, and you should be hungry for the knowledge. Of course, you have some good breakfast, but you should be hungry for the knowledge. And we have of entire institutions management with a lot of regard and love. I welcome all of you. Thank you. NIYATI-2026.
It is my great privilege and honor to introduce our esteemed guest for the first session, Dr. Shakuntala Patil ma'am. Ma'am holds a BLS degree and has completed our MD in Rasa Shastra from Government Ayurveda Medical College, Bengaluru. Ma'am has clinical experience of over 29 years and she is the founder and chief consultant of Yelpuresh Clinic and Panchakarma Unit, Bengaluru, where she has been dedicatedly serving patients with a special focus on Rasaushadis in the management of chronic and complex disorders, including infertility, Vata Vyadhis, hypothyroidism, and notably cancer care. Her vision extends far beyond clinical practice. She is also the visionary founder of Ravo's Trust, that is Rudra Adbhuta Ayurveda and the Nun Shelter, an organization committed to Ayurvedic cancer care. Under her leadership, Trust has built a strong national network of more than 1,000 Ayurveda physicians actively engaged in cancer awareness, screening initiatives, and systematic documentation of cancer case studies. She has organized several screening camps for breast, oral, and cervical cancer. In recognition of her remarkable contribution to Ayurveda, she was honored with the prestigious Ayurveda Vishwanatna Award in the Second World Ayurveda Summit 2021. In addition, ma'am has also been featured on Ayush channel and DD Chandra television program, where she has shared her insights on Ayurveda and healthcare. On behalf of the organizing committee, it is my proud privilege to welcome Dr. Shakuntala Patil ma'am for the first session. I would now request you to take over the session.
Thank you so much for the warm welcome to me. Today I am really honored to be here. Should I?
Yes ma'am, yes ma'am. On again, actually. I'll connect ಮಾಡಬೇಕು.
I'm really honored. I really thank KC Department, JSS College and Sarveshwar sir, and special thanks to Veena madam for this opportunity. Having very short experience in the field of cancer, they have invited me to share my cases on this big platform. This is actually big honor to me. Really, I thank all of them. Before starting this my session, I really seek blessings from God Dhanvantri and all my gurus who has made me to be in this platform. Om Shri Dhanvantri. Let us start the session without delaying. Most of the things what we are doing in Raw's team, they have already. It's all about Raw's team. Already they have shared so many factors, and in that 2-3 points they have left. That's all. We usually conduct 3 classes in a week from the Raw's team. Why this network started? Because Raw's is Rudra Arpuda. Because when I was an UG student, I usually think about cancer as not getting cured because it's a asadhya. It cannot be touched in that manner. Usually that happens. When I wrote that down that I can start treating that, then it seems somewhat I can manage with some of the things. That's how my thought process got when I started this Raw's team. And the main making the network in between all Ayurvedic Vaidyas, that's what this is started. For that we need to learn. We need to go back what our science says. That's why we have started 3 classes in our group. One is on Monday, which is especially on yogas. We refer the book Satantra Sarava Siddha Prayoga Sangraha. We take 1 yogas, 1.5 hour about it will be the class. One will read, another will share the experiences. It's like that actually. And by that I have learned actually. And after that Thursday is on cancer. Now breast cancer is going on. This is 2nd time we are doing breast cancer. And 3rd is on Samhita Parana and morning class Vijayalakshmi madam is going to take. And another class we have recently started on Friday it will be research and documentation. After coming from Coimbatore CCRS team, I saw that there is a very need of documentation. So just we have started, we have made the protocol. It about to come out case papers from Raw's team. So if we are around 1025 because now the group is totally full. Even though many requests we are getting, we are not able to admit them in the group. That is the thing going on. So this is the class, and apart from that we have started recently after coming from Pune, because usually we do Ayurveda. That is we go there where these Ayurvedic Tadnyas, cancer Tadnyas treating, we go and visit their places, we see what they are doing, how we can adopt, at what level we can do, we will discuss. That is we call as Ayurveda. After seeing coming from Pune, we have started Guru Shishya Parampara from our Raw's team. I have 5 students in my clinic like that. So many 6 to 7 gurus are there now in Bangalore itself. And apart from that, other things, cleaning camp and other things they have said. And I don't know much about the modern aspect because allopathy version is doctors are coming up because very short time. As a definition says, it is a disease in which some of the body cell grow uncontrollably and spread to other parts of the body. Cancer can start at almost anywhere in the body. Please listen, anytime in the lifespan. It is not like limited, like it should be get in the later lives, midlife. It is not like that. Because I have seen the cases. 2 months I have heard, because I am the founder of this Raw's team. I usually get calls from all over India. So I heard in a Kolhapur, only 2 months baby got the cancer. Then what? Papa Karma it has done. See, so anytime it can be said, and this is the thing. And be normal, and I don't go much about these things because many of you know very well. Directly I will go to how we can approach cancer according to Ayurveda. So when cancer patient patient comes to me, usually nowadays like everyone comes with reports itself. They don't come without report. Some of the cases are actually recognized by us before the symptoms. As our Acharya says that in textual reference, we have to go deep for this. So that's why they come with the lakshanas first. Then we have to dig their nidanas. What could be the probable nidana they have? This is the most important part of our treatment, because if we don't go dig how what could be the nidana, it will be a blunder mistake for us. Because according to nidana, we usually treat how we can go. That is the thing. And which stage it is, according to Ayurveda and according to allopathy. And actually which system it is affected, how we can correlate with our samhitas, and what prakriti it is. This is most important, because for example, our breast cancer patient, if they have come with the symptoms of some same degree, same everything it is there, but treatment protocol will be changed. Maybe some of the medicine will be the same for the sthana and other srotas and other things, but according to prakriti, whole treatment will be changed. That's why prakriti is very much important. Prakriti of Purusha, prakriti, what is the dosha involvement, which dosha we can see as a vector, like a aggravated dosha we can see. That is also main important while treating cancer. And srotas, which srotas is affected, and which roga marga it is involved. That is also most important. By reading we see like roga madhya, like we usually do the gut so many times, but why they have told roga margas, why they have told srotas, how that channel goes and how it nourishes that part of the, that is most important when you are sitting on the chair, when you are seeing the cancer treatment. That is most, because that is the most time I usually say my student, that is a hot seat what I am sitting, because in front of the patient seeing in my eyes what they will tell, whether I am going to die or I am going to save, she is going to save my life, because it is a very big challenge for us almost all, apart from normal cases. And dhatu, which dhatu it is affected, for example, we are taking breast cancer, whether it is, which upadhatu it is, and along with that, when we are taking breast cancer, breast is nourished by prasadhatu, it is upadhatu of nurse, and another upadhatu is artha. Then what is, whether it is affected, whether it is not affected. Affected means in what level? Because nowadays we are getting fibroadenoma cases in very young girls, where we are seeing overnourishment in the breast part, that they are getting fibroadenomas, but srava in artava srava is very less. When we have started artava srava, particularly like with the Ushna drug, then automatically that channel has opened in both the manner. Like they are getting cured by that manner. So we have to think in that manner also. And Arishta Lakshana according to Ayurveda. Because Ayurveda, allopathy doctors usually send, this is not good or curable. After many patients are coming from ICU ward. But if we treat at least for 4 to 5 months still, according to allopathy, Ayurveda, I have seen first case is like when patient visited me, it is a pulmonary carcinoma, adenocarcinoma. Their relatives, son and daughter, contacted me. They are told, no, she is having some breathlessness, that's all. Please come and see, she is not able to come. When I saw her, she is completely bedridden. Gandha what they have told in our text, that what I have seen, completely deteriorated. Nadis, what they have told, like it is a Vishama Nadi, we cannot explain that case. And what we say, like, that is, we have seen in our eyes, like, we are not going to treat this case. With our Arishta Lakshana, we have to decide whether we can treat or not treat. And don't give the, I request, don't give the false hope to any patients by treating. And we have to treat, we have to make the treatment plan according to Ayurveda, how we have to go. We have to do Ashtavida Pariksha, Dashavida Pariksha, what type of Panchakarma involvement we have to do. Because you are lucky people, you have onco unit here, and Beena madam is taking care of that, and all the AC unit is taking care of the department of onco unit. And really, you people are really lucky. You are going to see cancer patients, but in our days we can't. Now, how to involve Panchakarma in that? So whether, because Bala as the Panchakarma chemo and radiation. I may not complete within 45 minutes time chemo and radiation because that was last time for me. Usually in chemo, I treat it as a Snigdha Ushna, and radiation I treat it as a Ushna Ruksha like that. In chemo, I usually think Snigdha Virechana, otherwise Privrit with Dukta, along with Kamaduga with Moktika, and manual syrup. It is I am getting very good result in chemo side effect. When I am going for radiation, directly I will go with Gritas. Shatavari Grita I usually take, otherwise Dadi Madi. Yashtipada Grita I have prepared by my own. That is containing Panchavalkala, Yashti, Lotus and Chaturjata. It is giving very good result in chemo and radiation side effect. One of my patients, which is in last time, that he has taken that treatment because he has the cancer in the neck part. He usually gets 6 chemos and 9 radiation. After that, his gums are swelling, he is not able to eat, and he is literally appetite is low. When I started this giving treatment and Nitya Virechana Kavipati Karachona, Eshtimadu Kruta, and then he started eating and his weight has increased actually. This is the very beautiful part what we can give the best to actually public or to the world, that we can successfully treat chemo and radiation side effect. And we have to see which type of medicine we have to see, whether we have to go for single, other we have to go for herbal combination, other we have to go for Visha drugs, because acting chikitsa, Visha drugs are wonderful acting. Whether we have to take for, usually we are going for Stava Visha only, even Rasa Vishas also I am including in my treatment. Especially I am including Samina Panakarasa in my treatment. That is for adenocarcinoma of lung. I am mixing with other powders, churnas. Later I will share that. Well, according to Ayurveda, I will directly go what would be the Nidana. Other Nidanas I will skip here. And profession wise, just this part I have clicked in my life, that in my brain, when the patient came with around 65 to 68 years old, it's already 2 years old. So he came with a complaint of adenocarcinoma, permanent adenocarcinoma. He was in last stage, and when he approached me, he has having the breathlessness and all the chemos and everything has over. When he has approached me, he has the loss of appetite, irritability, and everything. First sitting, I am not able to take his Nidana. Because he is very particular person, he is taking everyday food, everything healthy lifestyle. When I asked about his Nidana, he told he is working in the shop where this rubber wheels are selling. That is the thing. Like he is working there. Then I have started near Samipasthasthana, like Anutaila Nase I have started. After that I have started Nalparamadavi Taila for and Chirabata Taila for as a Pratibhaksha nursing. That has given me a wonderful result. After 7 months he died due to severe asphyxia like that. Because he find because patients are getting confidence after 5 to 6 months they will be leaving over because with our treatment. But it is not the real fact, because all the dhatus are affected. That is the main thing. That's what we can say. So other profession we have to take consideration, others are here, and we have to think what is the mistake in Trayopastama. That's the main part we have to think for the Nidana. After that, genetics, see, one genetic runs in the family, but why only one are getting? Where the Trayopastama is hampered, that we have to think. Along with that, nowadays, as I said, many young neonatals are affecting with cancer because of Garbhini Parichara has not properly done. Whether it is only Garbhini Parichara or Rajaswala Parichara. Because from our team we are doing awareness program online and offline, Dinacharya, Rutucharya, along with Rajaswala Parichara, which is we are going to school recently. Last week only I went to one school where I have seen 200 girls are there from 6th standard to 10th standard. Now I asked him for this one, how many are affected with these menstrual disturbances? More than 60% of them are raised there. Not because they don't know what is Rajaswala Parichaya at all. I have requested them, that went very well because we have committed only for 1.5 hours. We have taken more than 3 hours to discuss with them. That much questions came to us. This is what, so when this Rajaswala Parichaya hampered, then that mutations hampered starting, then in total Garbhakosha is going to affect. Meanwhile, even Stana is also going is and her child will end up in some or serious disease or some malnutrition effects or some maldeformities in her body. This is so I request all the girls and who are present here, kindly go and tell her, because I have seen some of the girls are from BMS only, they are not at all doing very good. Resala Paricharya. Please go and say about these things. This is very important. Apart from that, other medication, improper medication and Amla Pitta, I want to take along with that, because improper medication and Amla Pitta, antacids, whatever they are taking, without knowing, just 1 rupee tablet, 2 rupees tablet that they are taking, then ajirna, it is going and lodging in some of the organs, that is called as dushi, which are improper medication also. This is all happening, and other things I am like, these are other things, I don't want to concentrate on those, because all the people know about it. Aghata Janya, I have seen in many cases of software patients, even from property. Just recently, one patient died, which property has not removed, and other who are working in high sounds, and all those things we can consider Aghata Janya. And nowadays, sanitary pads, now the MC pad antis are coming. We have to promote that also. Not using sanitary pads, because they are giving that sanitary pads may cause this problem, may cause that problem. Why not go for our golden days with this newer thought that we can adopt? That is the thing. And apart from that, Ekarasa Sevana, because one of my family member died because of Ekarasa Sevana. One type of food he is usually eating. Morning upma, afternoon this gorekari sabji like that. That's all. His sabji will be that only. Ekarasa Sevana, one type of food, other nourishment is not happening properly. This is the thing. That's why we have to promote Shadrasa Sevana, all type of food they have to eat according to their prakriti. According to what satme, what not satme, that has to be considered very well. And other infectious disease. And one more is Stanya dosha. Why I have included, because in Stanya dosha almost all causes are because of food habits only. Ajirana. Why I have included in this this one is Manasika Vikara with Ajirana. Ajirana, because of so different type of food they are eating. One person is usually in our Kannada, they will say Satru Huttupuna Sutru Hogala anta ಹೇಳ್ತಾರೆ. They are eating in even when they are eating in the postnatal stage, then they are eating throughout their life. This type that may cause other type of cancer also. And one more, why I have chosen this one, because the simple remedies what they have given for Ashtaveda Stanya dosha, they are remedies for cancer also. And Stanya Shodhakana, what they have given, that are the excellent medicines for cancer. That's why I have included this slide. And according to Ayurveda, it's Granthi, Apachi, Arbuda. And because of Vatadi Prakopa, due to n number of causes, it vitiates moms and forms Vrutta Stira, Mandaruja, Mahanta and Arnalpar Mula, Chiraruti Paka Shobha. This is called Arbuda. And when all doshas aggravate, they affect various tissues, that is Dhatu mainly, Rakta and Mamsa, produces vitiation of Agni, because Agni is main part when you are treating cancer. If you don't treat Agni, then you are not at all treating the cancer, because if you are giving so much of rasayana, so much of other things, if Agni is not present, then there is nothing like absorption is not at all there, and that is causing other disease. So Agni is the main cause, which is formation of Ama. Ama creates obstruction in channels, which in turn creates swelling in Shodha is the main part when we are telling about cancer. Shodha is also one of the cause, and nowadays they are more going into deep. Visarga is also one of the cause, and Kushta main manifests for the cancer. That's what the recent research in Ayurveda we can say, swelling which may be circular, deep-rooted, but just increases in size. In the process of development Arbuda, the most important factor is uncontrolled proliferation of cells and tissues. These cells can spread all over body through rasavas rotas and get lodged into various organs and systems, producing different symptoms. Tridosha mainly Vata, and Agni is mainly here is Jatragni, Dhatvagni, Bhutagni and Manasika Vikara. And according to Ayurveda, it is a 6th type, and according to metastasis, there again they have told Adhyar Buddha, Virat Buddha and Dvanvar Buddha. And when we are taking Chikitsa part, usually I take the Chikitsa part in the this type of Tipana. I have usually Kshezakas, where they have given, because in the cancer also, nourishment is very low, because nourishment only towards one organ, arbuda, towards arbuda. So other organs, other body parts are not nourished. That time we have to give Deepana Pachana, Shodhana, Sloto Shodhana, Brahmana Rasayana, and Anulomana, Vyadigarana. Simultaneously we have to treat like which, whether ama condition is there, whether condition he needs Rasayana, because usually we think like Rasayana will be the last part of the treatment. That is not like that. We have to treat simultaneously which drug does the Rasayana as well as Deepana Pachana. Which drugs does Sloto Shodhana, like that we have to treat and we have to take care. And uptake it's a Kakaparva is nowhere, but I have seen Nasya treatment of one of our colleague Dr. Harish Babu sir, then uptake it's in ventilator for severe this one Kamala Roga. He has given Anjana treatment in Hubli, but he is not able to stay back. Very second day, that after treating second day, the bilirubin count came down like comparatively previous one. So uptake it's whatever they have told in our text, we have to refer it very carefully. And Anjana, Basti, Sadhyo Umana, Sadhyo Virachana, what are the labors? Because in cancer treatment, labor stands very well in almost all. Simple labor, it is not something we can think. Simple labor we can think of. And Shirodhara and Bhutta in Rakta Mokshana, because Beena Madam has done Rakta Mokshana for one of our colleague doctor only, which is in the 4th stage of cancer. Maybe even Madam is going to share that cancer case also. And immediately the hiccups came down. And even they have started taking, and even vomiting also came down like that. So Rakta Mokshana is also considered as a one Ateki Chikitsa. When last year we went to Tapansar, there I have seen that sir, last month only sir came for our webinars, because every month we conduct webinars also. Sir told about maggots. Maggots in jungle variety maggots, one of the maggots, eat harinina, jinkena, it eats within 3 hours. That complete, it eats even bones also. So that's why sir has got that jungle variety of maggots. Why I am sharing this to all of you, because this also we can consider, we can avoid surgeries also. Sir tried this also. See the dedication of sir, Tapan sir, because sir has treated more than, just I am beginner, sir has treated more than 44,000 cases with documentation. And sir, after that sir collected that maggots from fishermen, and he has started introducing in breast cancer, which is around 9 to 10 centimeter around, and it is where, and after 3 hours, almost all that breast mass gone, but it has started eating inside also. Then sir has taken out, and next sir tried with ligating in the last part and introducing in the body parts. That is the thing sir has tried last, because he has done almost all. Marma Chikitsa is applied, and even Agni Karma he has tried, everything he has tried. And combination of drugs we have to use, whether we have to go for Rasaushadis, how we have to go for Rasaushadis. And system wise choosing medicine. Why I am added this slide sentence, because whatever we treat, it is not something impossible thing we can treat like that. If anything coming for head and neck medicines, we can treat, we have to treat with that medicine only. There is something magical medicines are not outside. We have to treat which dosha it is, which stage it is, how we have to go with, that's all. And which our Yakti stands first in that. In head and neck, in breast cancer, breast part, what we are studying, just as that medicine only. If we are treating for liver cancer, we have to choose the Kamala treatment of Pandu Kamala treatment of line only, Kumbhakala Kamala latest. That type of medicine we have to treat. It is something not miracle drugs. It's all in our drugs, but we need to choose it very carefully. Rasayana stands very prime treatment, and in my treatment, usually I use all these lesser drugs. First and foremost, I use Shiva Gulika in my treatment, because when we are going through Shiva Gulika, it is having all the drugs like Vata, Pitta, Kapha drugs, almost all it is having, including Rasayana drugs also. And it has Deepana Pachana drugs, everything. You please go with, after taking photos, please go and study this Shiva Gulika and other drugs which are very much important in our, because and it cures from head to toe. You start with the Unmada Apasmara and you slowly come down. It treats even this one sleeper also. Yes, because I have discussed sleeper also. It treats almost all diseases, and they have Kalashati I have given directly. Granthi and Arbuda Vidradi it can be given. So means when you are treating head and neck cancer, you have to go with what we combination and how to make. In head and neck cancer, because I may not complete other slides, that's why within a short time I will share here only. But when how to include when I am treating brain cancer along with Shigurika, let us take it is a Deepana Pachana and Rasayana therapy. What I am choosing for Shigurika. As Vyadihara also, as it has given Arbuda. When I am treating along with this, I will make a brain cancer. Usually I choose Hiraka Basma and Swarnamakshika Basma. Along with that, I choose Pravala Basma along with that, and I will make mixture along with Amrita Sattva and Yashtimadu Churna. This much only. We can take other major drugs included. That's what I have told. Whatever drugs in that part they have told, we have to choose that only. We can choose other drugs. Ashwagandha we may use. If Ushnata is more, then we can choose Shatavari. If we need like Guduchi, Pitta Pachana, Ushna Pachana is there, we can add other Amrita Sattva. Like that we have to whatever Radimadikrita and Ashtikrita as an anupan for this usually head and neck cancer. Along with that, Anulovana purpose usually along with Dukta, Elendakala usually I use, and Panchanavagruta if the Kapha Prakriti patient, and Kalyanagruta also. Usually that is the first line of Unmaga Apasmara what we get as a reference. That we usually I use. Like that, and Anupara Varanadi Kashaya is a Kapasthana, and Sukumara Kashaya according to the Agni or their Ajira we can go for Sukumara Kashaya, Varanadi Kashaya, Rasnadi Kashaya. If pain is more, that we can think of. If pain is more, external application, Vacha stands very beautiful. Like only Vacha along with Dashangalaiva. If you are going for any pain management in the Arbuda or any type of pain management in Gantri, it is giving very good result. With Ushna Jala you can go for, with Gomutra you can go for, otherwise with the turmeric juice also that you can go for as a lay bath. It has given me wonderful result of my neck cancer, thyroid cancer, it is especially Galaganda she has, and later it has become so much, she is don't want to treat herself. That time I have given, now actually after taking 20 days treatment only, now she is fine, but she don't want to continue her treatment, that much stubborn, because it is very difficult for us to treat cancer because patients are very stubborn, they don't want to take treatment. So second is Swarna Sutta Shekara. Swarna Sutta Shekara usually Swarna medicines I usually give because Vata Pittatmaka conditions. When we see Swarna Sutta Shekara ingredients, almost all are Vata, Kapha, Hara drugs, and Bhringaraja Bhavana is given to it. And beautiful thing is that Tamra is there and Abrakavasma is there and Swarna is there in this. It is very good in the treatment of bone cancers, it is very good in the treatment of any stomach cancer and even liver cancer. In brain cancer or almost all cancer it can be used as Rasayan also, because in the end stage metastasis when happen to liver we can take up Swarna Sutta Shekara. One thing. And another thing, as Aptayika Swarna can be used, it has given in our text, but we never used. I never used, to be honest. When we went last month to Panchamaya Damaniya sir has saved more than 100 patients with the Swarna Basma only along with honey. That was they have given in the textual reference. One prati of Swarna Basma for 2 to 3 days. If when the patients are in the death bed, usually sir is called for that. Sir is very busy person. He starts his OPD around 5 o'clock and he sleeps around, he completes his OPD around 10 night. That much patients, around 150 to 200 patients sir usually say. In that busy season also sir will go and see, and he tells, इसको चटाना है बस, वो 2-3 दिन के चटाने के बाद they will get consciousness, some of them immediately after 1 month. I spoke with them who are actually survivor of the last stage also. After that, last month only, I have told about that copper incision which has not removed. Because of that, Agatha Janya, she got other reasons are also there along with that, and that she got uterus cancer. cervix cancer, and she's in the after train. And I spoke with Veena madam also. For that we have done. She came to me for chemo and radiation side effect because that metastasis happened to rectum also. Because of that radiation, she has started passing her stools for 20 to 25 times per day. It's not at all controllable like that. Just I have given Dadimastaka Churna along with Pravala Basma and Panchamrita Parpati, that's all. And along with that Shaganda Pani I have asked her to take. And very next day evening that came to normal for 4 to 5 times. I asked them to take a Peptofer tablet if it has not controlled. Because just she came from allopathy hospital, I don't want to implement so many medicines. After that 2 days she is able to walk also. And after that she came to my OPD and we have started Yoni Dhavana and Matra Basti with the guidance of Veena madam. And Matra Basti we have done just for one sitting with Jatyaditya in Kankara Basma. And this much mass came out from her anal route. And but because of that she has developed a severe pain. We have not continued later that. We have subsided that with Shula Vajrani later. And after that she went for when Yoni Dhamana happened and our results along with that I have given. She became stable for after 15 days. She again went for chemo. And the metastasis happened to, because she's in her last stage, that's in liver. They have taken twice biopsy. After taking twice biopsy, patient got severe pain. She is become unconscious 1.5 months. And one day they have called me for that treatment. When I go for that, immediately I went and checked for BP and sugar. Sugar was lower inside and BP was triggered. BP is around 100/70. Immediately Swarna Sutta Shikhar I have introduced along with Bratvata Chintamani Rasa and Rasagarba Potali. Usually I prepare some of the medicine in my Rasashala. I just that time I have not prepared a Hemagarba Potali. That's why I gave Rasagarba Potali licking every 15 minutes. I asked her doctor to do it. And after that, after 2 hours, she got the consciousness, and I advised her for Drakshadi Paka, famous SM Pandit company. She lived for 2 days with that Drakshadi Paka only. After that, that pain was not bearable. Then we were admitted to Kidwai hospital. Then she after 15 days with our medicines only she was alive, and after that she passed away. This is because I have just tried with Swarna Sutta Shikhara. You people also can whatever available Swarna medicines. At that time I don't have Swarna Basma in handy. That's why I have done like that. And Kamadu with Moktik I have already told in almost all type of chemo and radiation side effect I use that one. And Gandamala Gandana Rasa, especially in head and neck cancer, especially in neck cancers and even mouth cancers also I use Gandamala Gandana Rasa and Ashtakuta Rasa and Nityananda Rasa. As we see the Sthana Falashruti, it usually ashes Arshas, it cures Arshas as the name says. But when we see the Sthana, it is Apanasthana. Whatever cancer comes to that, Ashtakuta Rasa is wonderful drug. Because in almost all patients, Agni is hampered. That time we have to go with Achakuta Rasa as a main treatment itself, not as a supporting or something like that. And Nityananda Rasa, because just difference between Nityananda and Achakuta Rasa, ingredients are same, just Bhavana Dravas are different. So Nityananda Rasa we can take for a pain management along with Shukla Vajrani Rasa, and Trailokya Chintamani Rasa. Brihat Lokanatha Rasa used in liver cancers. Usually I get Brihat Lokanatha Rasa, something Koti Nagarjun sir made himself, and he is supplying that medicine. And so I am using Brihat Lokanatha Rasa in almost all cancer. And along with that, Trailokya Chintamani in the last stage. To say that Trailokya Chintamani Rasa and Brihat Chintamani Rasa, I want to tell one beautiful thing. Almost all drugs, main drugs, whatever they have told is all are rasayana, all are precious drugs only. They have given along with Rasasindura, they have given Hiraka Basma, Swarna Basma, Rajita Basma, Moktika Basma, Pravala Basma, and in Trailokya Chintamani they have added even Nisha drugs also. Even they have added Manashya and Tara, and along with that they have added Shukti Basma along that, and Bhavana is, and then special preparation is in the Trailokya Chintamani Rasa. It can be used in Arthaya Chikinsa, it is very costly, and Brihat Chintamani Rasa, with gold it is around 3,000 somewhat, without gold we can Swasa Kudaravasa as a Vyadihara use because it contains Manashina in it, as it does uptake it, it's like almost all Tamaka Swasa cases or pulmonary adenocarcinoma cases. I use those things. Along with that, Brahmi with God, metastasis happen to any kind of metastasis happen to brain. I use Brahmi with God. It is very good cancer and liver cancer and intestinal cancer I use. Shadabasma also I use. Pulmonary cancers I use and brain cancers also I use because it is a Vyadihara, a Krimihara and make them. I will go quickly and share one this thing. And Panchamrita Parpati in almost all Grahani cases and other conditions where I get Agni's hamper. And case one, like it's a first case I have treated successfully. Like it's a 60-year-old female who come with a metastasis of liver, lungs, and brain and thoracic cage. It's in left side. Mass is around 8 to 9 centimeter. It's very hard. And they came to me. Ayurveda hogi jaundice kami ಮಾಡ್ತಾರಂತೆ. They have sent to me actually because they are not allopathy doctors not able to treat when the elevated bilirubin count around 17. That's why they sent to me, sent to Ayurvedic, and she is having severe backache, not able to sit and loss of appetite, nausea, weakness, severe pain in the wound part. These are the reports of her, and she is. I got so much of Sushilama case. Almost all names will be Sushilama only. This is the approach Bekavarna what they are telling. I only one picture remained with other are due to technical error. This is the word of her hand, and this is the condition when she approached me for this. For that dressing I used Jatyadi, Tankana and more of Tankana Basma. To tell beauty of Tankana, it is having Sharana effect because last 1 week back only my maid, I asked her to do in Loha Patra for Tankana Basma to prepare, but she this aluminum patra will be the kadai will be the bigger one. She want to complete it fast, that's why she made. After second day, this much hole has become and around 2 centimeter. I missed to take that photo. That much Sharada effect is having, but we have to see that because they are very, it is very painful. They are having the pain that we should go with the yukti. What type of daily we have to increase. Harish Babu sir, then only Jatyadi Kaila and Tankana Basma, whole masses came out with dressing, Panchavalaka for wash. And Tripura also we can take it as a for. This is after this they went for surgery. This is a first line of treatment what have been. Pitta dominant dosha, Rasarakta Mamsa Medodata is effective and Shukra is also effective. Manashika Dushti is there. Pritittajana I have seen. I have treated Kamala line of treatment. I have given Amrita, Air, Bala, Air, Bala, Air, Bhumamlik and Kumaris Varsa every day 20 to 30 ml in the morning. So that is the first line. And after that, BV as a 10 ml BV, Nitya Virachana. I have changed so much of Nitya Virachana because she is the Arshad patient. Nayopaya, Kashaya gave, sometimes I gave with Erenda with the Dukta, Trivut layer, sometimes I gave with Pakarapati Choda, Stanya Chodaka Gana and Niku Vachaka. Tablet also gave for Deepana Pachana medicine. Brahatlokanatras I gave. After 3 months continuous, after 2 months she got the report, bilirubin count came to 2.6. And SGPT, SGP2, because SGPT, if you see last like it's about 4 to 40 times. But it came around in between 50 to 60 range, and the patient went back to surgery, and she came after 6 months because they came for only jaundice treatment that has cured. They don't have the idea that we have cured her, we have treated her Arbuda. But after 6 months when she came, she was in a bad stage. She discharged from ICU ward. She has the ascites. Just I missed the readings actually. We have taken, it was around 150 centimeters something when we did it. And after 15 days, by treating with the same above medicine, but here I added a Swarna Sutta Shekara, later I have added Amrita Kalasha, later because I have treated more than 7 months, because allopathy doctor said only 15 to 1 month lifespan. And in different level I have added this drugs, as a Rasayana therapy, and Brahmin gold has continued. Previously she don't have that shivering of hand and painful in the hands, but this time she is having that pain in the hands and she is not able to lift the things. That time when again we have started with Brahmin gold, within that 1 week that has controlled. This is thing, and Bhungajana throughout India. They advised me to do this. So I have done that, and Erenda Patra one day, Artha Patra one day as a covering that lip. And it should not be tied so much tight. It's very small time you have to be. When she will get the irritation, I asked her to wash it. Daily 2 times she used to do. When she is getting so much of irritation, I advised for Dashangalipari also, along with Vilvadi Gurka, which is Dishara, and only on Chuti Siddhajala we asked her to take. Till her death, she used to take that for me. Completely she was fine after for 7 months. And she thought I have become completely normal. Again, she has started so much of work during the Shravana Masa. She has done so much of cleaning. Within 1 week, all the symptoms will aggravated and she died within 1 week. And the stomach cancer, beautiful case it is. 70 years old female. She came with Amla Pitta with a Tajina symptom. That's all. And when we saw the PET reports, it is a metastasis liver and brain. These are the reports. And she took very short time of treatment, but she lived a long time. Initially, I was treated only with a Tajin line of treatment only. Avipathikara, Shankavati, I gave Amla Pitta missionary. She was fine for 1 week. After that, again she tried with hemoptysis. Then, Koti Nagarjun sir usually prepares drugs. He is giving Urtvada Pitta tablet with this Bhavana, Vasa Bhavana. Sir gave 1 kg I gave. Along with that, I gave Brahmi with gold. That's all. 1 OD. Only this much treatment, she is fine for. I have continued. She has taken for 3 months. After that, she is very stubborn patient. She has not came back. And in between, her daughter-in-law, she used to call me, and she usually felt that she is fine like that. She is having some gastric irritation. That's all. Last year, she called that her condition has worsened. I think last year she expired. You see the date. It is a 2022 case. Last year, 2025, she expired. This is the 4th stage lung cancer. Again, Sushila Manian. And Ratri Chandra Upvasa and stress is also main cause when we are seeing in Shwasakasa Nidana. And when she came to me, SpO2 level was 80, loss of appetite, breathlessness, not able to walk for smaller distance. She is not able to come from her bedroom also. And she is on some hospital, she is on this oxygen mask also. And pain in the chest, and she is the history of hypertension, diabetes, and urticaria. See, all the Nidanas, Amashya Ortita. We have to treat Amashya, Ajirana, that's all. This is, and she is having pulmonary embolism, they left me. And allopathy doctor told only 1 month lifespan, don't keep her in hospital. You can take her to home. She approached in that stage only. She is actually a Mysuru patient. She approached in that stage only, and that time only they have came, and first consultation I have done online. Right lower collapse happened. Metastasis to thoracic, liver, and brain. And dosha is vidosha, tapasthana, rasarakta, mamsara, hruday, samsthana, dosha we have seen. And I have this combination, why I am quickly going like this combination I use in almost all pulmonary cancers. Usually that what I have told, combination of Mahatali Sari Churna, Amrita Sattva, Kankana Basma, Sahasraputi Abrata Basma, Kamavam with Moktika, Swarna Samira Panaga, half tablet divided into 15 days, 2 to 3 times Anupanasa Kashmula Katatra Kasha. Nowadays I will change along with Shwasakasa Chintamani Rasa and Anupana I change accordingly. Even Kasa Sudhakalpa is also giving wonderful result in this case. Nayopaya Kashaya is Nitya Virechana. Sometimes I give Amrutatara Kashaya also. Agastya Ritiki Kashaya also I have changed. And within 15 days, SpO2 level becomes 96 to 98, and all the Agni improved. She is able to walk. She has started walking for 15 to 20 minutes on her terrace, and LFT become completely normal. LFT and RFT. On Saturday, I am very much like remember till that day. Saturday they came with the reports. It is completely normal, and they are very happy, and they are asking whether she is able to. We are able to save her. I still said it is a very critical case at heart, but we can manage with the supporting management like that. I have told. In the same night, her brother died due to cardiac arrest. She cried whole night. In the morning, she got this chest pain. When she got this chest pain, to taking to hospital on the way she died. This is the case. So last case I will share. Is it okay, ma'am? so much once again for this opportunity. If time permits, next time I can share the other slides also. Thank you so much, delegates, for your patience listening, and thank you once again, ma'am, for this wonderful opportunity. I'm blessed to have it.
Thank you, ma'am. That was a truly insightful and inspiring session. We sincerely thank you for sharing your insights and vast clinical experience with us. On behalf of organizing team, we kindly request you to accept small token of gratitude and appreciation. I would now like to invite Dr. Deepa C. Patil ma'am and Dr. Veena ma'am to kindly present token of gratitude to them.
Rakshit. Lights on. ಇನ್ನೊಂದು ಲೈಟ್ ಇದೆ ಆನ್ ಮಾಡ್ಬಾ ಬಿಡ ಬಿಡ ಬಿಡ
Thank you. Now I invite Dr. Pooja to kindly proceed with the
Good morning all. I would like to invite Dr. Sahana Ganesh to come over the dais. Now I request Dr. Deepa ma'am to welcome ma'am with the flower bouquet. It is my honor to introduce our esteemed guest speaker for the second session on the topic radiotherapy in head and neck and GIT malignancies, scope for integrative support by Dr. Sahana Ganesh. Ma'am has obtained MBBS degree from AJ Institute of Medical Science, Mysuru, and completed MBA in Radiation Oncology from Kidbai Memorial Institute Oncology, Bangalore. She also brings international research experience in biomedical engineering from National University of Ireland, Galway, work on biomaterials and now regeneration. Currently working as a radiation oncologist at Bharat Hospital and Institute of Oncology, Mysuru. Her academic interests include advanced radiotherapy techniques, motion management, and translation cancer research. It's a privilege to have you here, ma'am. Over to you.
It's there.
Good morning, everyone. I would like to start the talk by thanking the organizers, especially Veena ma'am. And also, it's a very unique opportunity that I've got here where we can discuss translational field where we can integrate different modalities and hopefully there will be better results in terms of patient care. So today my talk will
Ma'am, the other way around.
I'll briefly touch upon understanding modern radiotherapy, just focusing on head and neck and GIT cancers. And we recognize what are the toxicity and what are the survivorship gaps in terms of treatment. And we'll briefly explore evidences where there is integrative support that might be required. And also, we identify safe and research-worthy areas for collaboration. What is cancer? As we all know, it's a very complex biological process involving mostly genetic or genomic instability. And also these cells, they need sustained proliferation signaling. And also they resist apoptosis. And only when there's nice vascularization, that is angiogenesis, they can survive. And they evade again cell death, and also that is how they metastasize also. And also they evade the immune system of the body. That's how they survive. So overall, cancerogenesis or carcinogenesis is a multi-step accumulation of all these molecular alterations. So it's very important that all these different steps have to be addressed in terms of treatment and also prevention. So right now, in terms of statistics, we have around 20 million new cases that are annually diagnosed throughout the world, and in these cases, at least there are 10 million cancer-related deaths. So that's a huge number. When it comes to India, it's around 1.4 to 1.5 million cases every year. And this also includes a lot of solid tumors. Initially, it was the liquid tumors which were increasing in number. Right now, it is the solid tumors. And also, the difficult part in treating these cancers is the presentation, which is quite late. Even though there is enough awareness in terms of cancer, we still see that the cases that present in the clinics are in later stages. So there is, what does it imply? It implies that there is need for a scalable multimodality cancer care. And also, what are we seeing in the clinics? That there are improved rates of curing. I'm only talking about radiotherapy here. So with radiotherapy, there are improved cure rates. However, as cure rates have improved, the survivorship has improved. But in terms of quality of life, we are facing major challenges, which has to become a priority right now. And that is why patients as such are also seeking integrative support. What is multimodality oncology? So that in allopathy, as we call it, there is surgery. These are the pillars of the multimodality oncology here. So it's surgery, radiotherapy and systemic therapy, which includes chemotherapy, targeted therapy and immunotherapy. And radiotherapy here is at least utilized in 50 to 60% of cancer patients at some point during their illness. So how does radiotherapy work? Radiotherapy uses ionizing radiation, which penetrates the body and uses the reactive oxygen species available inside the body and causes DNA damage, which leads to tumor cell death. So in radiotherapy, we have something called as fractionation. So if we plan to give, in radiotherapy, we use something called gray. So radiation is measured in terms of gray. And fractionation is how many times can we give that dose. So we cannot give the entire dose on a single day. We have to divide it. That is called as fractionation. And this fractionation is done because we have to spare normal tissues. Because tumor does not exist as a single entity in the body. It is surrounded by normal structures. So when we give radiation, of course it will go to the surrounding normal areas. So when we fractionate radiation, we try to spare the normal tissue so that the toxicities are avoided. With advances in technology, we have increased the precision with which we give radiation. And there is improved results as such. Where is radiotherapy indicated? So there are different indications for radiotherapy in head and neck and GIT cancers. First is definitive, where we want to preserve the organ. For example, in CA larynx, we want to preserve the patient's voice. And in CA esophagus, we want the patient to swallow. We don't want the patient to have a hole throughout his life, which is quite debilitating. So in that stage, it is called definitive therapy. We are preserving the organ and also treating the cancer. And then there is neoadjuvant. Neoadjuvant is pre-operative. When the definitive modality is surgery, but at the presentation itself, the patient is not in a stage where it can be operated. It has become locally advanced and the surgery is a little bit difficult. So in that time we give radiation and we shrink the tumor and make it easier for the surgeon to operate. And then there is adjuvant. Adjuvant is after the patient has received the definitive treatment. Either it can be surgery most of the times or chemotherapy, and then if there is some leftover tumor or positive margins, then there is lymph nodes which have evaded. So that time it is given as an adjuvant therapy. And then in the end, palliation. Palliation of pain, palliation of swallowing difficulties. In all those cases, we can give it as a palliative modality. Coming to head and neck cancers, what are the subsites? We all know that oral cavity, oropharynx, larynx, pharynx, all of them are the subsites of head and neck cancers. And the risk factors are tobacco. It's not the complete list. We all know that it's multifactorial, but most of it in our Indian setting is mostly because of tobacco, alcohol, and HPV, which is one of the subsets. And biology is predominantly it is squamous cell carcinoma, and often patients present at a locally advanced stage. So coming to radiotherapy in head and neck cancers, again I've already told how it is, why and what are the indications as a definitive chemoradiation modality, where chemotherapy is used as a sensitizer to increase the effect of radiation and as an adjuvant post-op RT and re-irradiation. In certain cases when patients have a recurrence and surgery is not possible or it can be debilitating, we can give radiation. But here the dose is reduced, taking into account that the patient has already received certain dose and there can be toxicity. What is the radiobiological goal? We have in radiotherapy, the principle that we follow is we have to treat the tumor with maximum radiation so that it kills the tumors, but to the extent that it does not harm the normal structures. So we have to maintain a balance. That's called tumor control probability. It is a balance between tumor control probability and normal tissue complication probability. So we have to balance both of it. What is when we treat the patient with radiotherapy, it's not just the acute effects. When during radiation they are having some side effects. So it can be either acute at the time of radiation or it can be later. Later it can go up to years. So the mucosa lining the oral cavity, the skin are some of the tissues which show acute effects in terms of mucositis, where there is epithelial stem cell damage, there is activation of the inflammation cascade and also ulceration. That is the acute side effects that we see. And in terms of later side effects, which is seen long after the patient has finished his radiation, is in terms of head and neck cancers, we see salivary gland has become fibrosed. So the saliva is thick, patient is having xerostomia. And also when there is microvascular damage of the mucosa, there is fibrosis again. And also the connective tissue has received so much of inflammatory signals that again the fibrosis pathway has activated. And also these the same thing. The toxicities are basically because they have been, the signals of inflammatory and fibrotic processes have been activated, and that is something which we can address so that we can give better quality of life even after the patient has been declared cancer free. Coming to GIT malignancies that is mostly irradiated is one is esophageal cancer, the rectal adenocarcinomas, anal squamous cell cancers, and very selected hepatobiliary and pancreatic cancers. These cancers come with a very special unique feature is that they are all having movement also within the body. So when we are giving radiation, we have to take care of that also. I'll touch upon that in a few slides. So then again, what are the indications of radiotherapy in GIT? One is as a definitive chemoradiation where we want to save the esophageal function, and also in mid-thoracic esophagus and upper thoracic esophagus it is not possible to operate, and also they are very close to the critical structures like vessels. So the surgeon will not operate. So that time it becomes a definitive modality. And in the rectum where we want to make it operable, we give something called as neoadjuvant long course RP. And also now the newer the theme that everybody wants to follow is total neoadjuvant therapy, where they want to take surgery out of the equation so that the patient has a better quality of life. And also anal cancer, where it is actually curative. Also in GI radiotherapy, the toxicity is very similar. The mucosa is lining the GIT, so there is and it is a rapidly proliferating mucosa. So it is very radiosensitive. So the side effects like gastroenteritis, the diarrhea, all of it is seen during radiation itself. And also the intestinal crypt cell stem, they become depleted, so the patient can have long-term diarrhea. And also the gut microbe can get replaced, they get altered. And also this is a cytokine-driven inflammation that we see here. And also later, when we give the RT to the esophagus and all, the fibrosis itself gives rise to dysphagia. Coming to radiotherapy as such, so there have been quite a lot of advances in radiotherapy. Initially when we started it was just 2D. So the patient was made to lie down on a couch and we used to give X-ray. It was just two-dimensional. We would not take into account the surrounding structures. So the toxicity we would see would be more. The patient would have longer duration of diarrhea and skin toxicity, which as the technology has evolved, we are seeing less of this toxicity. So it came to 3D CRT, and then IMRT, VMAT, IGRT, SBRT, and now we are practicing something called as adaptive radiation. So we have moved on from just seeing it as an anatomical entity to a more biological precision. What just not confuse or with a lot of RT jargon. IMRT and VMAT is basically they are taking they are telling the software that okay, I want to protect the normal tissues. This is my tolerance of the salivary gland. This is my tolerance of the mucosa, oral cavity, the bone, the spinal cord. But you have to still give the tumor this much dose. So the software will plan according to that. So that is IMRT and VMAT, which is given in arcs. The machine moves in different arcs and the rays are directed to the tumor. We can see it in the picture on the left side. So that has in head and neck cancer, especially where the salivary gland plays a very important role to prevent xerostomia. It has reduced salivary gland doses and it has improved the quality of life. Then now we have moved on to image guided RT, where every day we see the tumor in the imaging and then we give RT accordingly. So the margins that the normal tissues are receiving have reduced, and also this has improved the day-to-day reproducibility of the treatment, and also it has reduced the geographic miss. Geographic miss is where we don't want to miss the tumor. and still want to protect the normal tissues. And also motion management is something where, see, we are not, our organs, especially the abdominal organs are moving with respiration, with peristalsis. So when we treat the patient is not static, the things are moving. So the radiation also has to be given according to the movement of the organs. So we do something called as 4D now. We take into the consideration the time at which certain phases of respiration are occurring, the stomach is moving, the liver is moving, and accordingly we give radiation, which has improved, which has really contributed to the dose accuracy, and it is especially important in esophagus and upper abdominal radiotherapy. Then there is something called as SBRT. SBRT is stereotactic body radiotherapy, where we practice something called as hypofractionation. Hypofractionation is basically hypofractionation, reduce the number of doses that we are giving, but giving a larger dose. But here the biology is different, because the advantage we get here is there is a steep dose decline. So the tumor is getting a very large dose, but as the radiation reaches the borders of the tumor, there is hardly any dose. So that is SBRT. So here we are protecting the normal tissues around the tumor, but the tumor is still getting irradiated. And the latest technology is proton. Proton therapy is, okay, so the normal radiation is when we irradiate the patient, there is an entry dose, there is an exit dose. So we cannot prevent the ray from getting out of the body also. But in proton therapy, once the radiation enters, all the radiation is deposited in the area where we want it to get deposited. So it is so controlled. So the toxicity is really less. Of late, we are using it in childhood tumors, yet to reach the adults. So we don't have much data also in terms of actual improved results. So what is the clinical reality? After all this advances in the techniques, are we actually reaping the fruits, or is it just an advertisement of all the machines that have been coming out? So despite all these advances, what we see is acute toxicity still persists. There is survivorship issues which are very common, especially related to the quality of life which is impacted. Because the patients are living longer, we have to focus on quality of life more. So with the technology being improved, especially in terms of precision, now we need to eliminate toxicity. So what is this supportive care gap that we see? One is in terms of head and neck cancers, we see a lot of grade 3 mucositis still, because most of our patients who are coming from the low socioeconomic strata, they are when they present itself, they don't have enough. The nutritional status is not good. So the mucositis, the dysphagia, the dependence on feeding tube is more. Also the chronic xerostomia, radiation dermatitis, and also cancer itself is a calyxic stage. So and when we give chemotherapy, all of it depletes the body of nutrition. So that cancer-related fatigue is always there. And though survival is improving, we have to now focus on the survivorship toxicity which is emerging. What can we focus on in terms of the biological areas? We can actually focus our interest on inflammation modulation, because now we have understood that it is the inflammation that causes toxicity, and also the oxidative stress that comes out. We have to balance it out. And we can also focus our interest on mucosal healing, the modulation of fibrosis, the immune regulation, because most of the cancer cells are actually body cells. So if we can modulate our immune system, where we can direct it to kill, that itself will help a lot of other modalities that are given. And also microbiome interaction. If we study and if we can see how we can modulate the gut microbiome alteration, maybe that can also help with the radiation enteritis and proctitis. And all of this overlaps with our radiation toxicity pathways. Also, it's another touching upon all the other potential areas. We can also study how the oral mucositis can be mitigated. The salivary gland, how can they be protected during RT, before RT, after RT, and also dysphagia, how can we rehabilitate when the patient is having fibrosis and cannot swallow food, and also dependence on feeding tubes like nasogastric tube, how can we prevent that, and also fatigue. Or the cancer diagnosis itself comes with a psychological stigma. With that, how can we modulate the patient's psychological distress? All of this requires mechanistic and clinical validation. We cannot just say that we do this, we do that. There have to be studies and results, then only we can actually validate. Then coming to GIT-RT also, we can study how we can prevent radiation enteritis, proctitis, microbiome restoration, how can we do it, and restoration of appetite and nutrition. And all of this needs is very strong clinical trials. So when we come to clinical trials, we have to take into account what are the herb-drug interactions that might happen, and also the radiotherapy as such depends on radiosensitization. So we can study if there are any unknown radiosensitizers that can be used. And also most of the radiation is depending upon the availability of the reactive oxygen species. So we need to make sure that the antioxidants are avoided during RT. And also dose standardization needs a thorough research. And in terms of quality control also we need to see if there is any variability, and also safety, which must take a very important position. It should precede our enthusiasm. So all this requires randomized control trials, standardized formulations that have to be made. We can do biomarker studies and also microbiome analysis and translational research. And also these have to be studied according to the defined endpoints. If we don't know the proper toxicity grading that can be modulated, then most of the results will not be validated. So what is an ideal integrative model? We have to have a multidisciplinary collaboration, which should be a protocol-driven Ayurveda support, and also we should document all the outcomes, and this should be along with the awareness of the patient. So in the end, I would like to conclude that radiotherapy is central to head and neck and GIT cancers, the management of cancers. Also, the technological advancements have improved precision, but they have not eliminated toxicity as such. So the biological overlap which exists between radiation injury pathways and the traditional anti-inflammatory concepts, they have to be bridged. And also the integration itself is possible in supportive care, which should be evidence-based, protocol-driven and safety-focused. And in my humble opinion, we should not pit one modality against another, and take a holistic approach and focus on patient related outcomes, which would be good in terms of quality of life, and just bridging the gap that is there in supportive care. Thank you.
Thank you, ma'am, for your knowledgeable session. On behalf of organizing team, we kindly request you to accept token of our gratitude and appreciation. I would now like to invite Dr. Deepa ma'am, Dr. Anikrishna ma'am, to kindly present our token of gratitude to ma'am.
Deepa, 6. Rakshit. ಆನ್ ಮಾಡೋದು ಇದು ಆಫ್ ಮಾಡೋದು ಆನ್ ಮಾಡೋದಿಲ್ಲ ಇನ್ನೊಂದು ಆಫ್ ಮಾಡೋದು ಇದು ಆಫ್ ಮಾಡಿ ಬ್ಲೂ ಲೈಟ್ ಆಫ್ ಮಾಡಿ ಇನ್ನೊಂದ್ಸತಿ
Thank you, ma'am. Now we will be proceeding with inauguration.
All the delegates be sitting here. The inaugural session will be starting.